first.
Thank you, Shailaja, for inviting me. And I think I've got 10 minutes to complete, so I will jump right into the topic. Can you all hear me and see my slides?
Yes, we can all hear you.
Okay. So, just a few basic terminologies to start with, and that is cleaning, disinfection, and sterilization. Cleaning is the physical removal of organic soiling material and is a prerequisite for disinfection. As I'll be talking later in the duration of this talk, that deionization and removal of organic soil is very, very important for the sterilization process to be effective. And it can be done, as Anshuman showed, using water with or without detergents and ultrasonic cleaners. Sterilization versus disinfection. We hear a lot of disinfection nowadays in COVID times, but sterilization means removal of all microbial, means bacteria, fungus, viruses, parasites, everything, including spores. Whereas disinfection usually eliminates majority of pathogenic organisms, but does not remove spores. So that is an important distinction. And we will be talking only about sterilization in this talk. So why is cleaning important? As I said, that the materials of the instruments, if they are covered with dirt, then the effectiveness of sterilization process will be low. Okay. So we have different levels of disinfectants, as Shogato was saying, high level, intermediate level, and low level. As Shogato has covered it, I will not be covering it again. But high level disinfectants are the ones that are commonly used in the OT, and they kill all organisms except bacterial spores. And the classes of disinfectants, alcohol is the lowest class of disinfectant and is active against bacteria mostly and some viruses and fungi, whereas higher ones like oxidizing agents like hypochlorite, H2O2, and quaternary ammonium compounds are effective against most classes of viruses and fungi as well as bacteria. Of these, now for fumigation and cleaning purposes, quaternary ammonium compound is the one that is most preferred. Is a very old classification which has stood the test of time, a classification of equipment into critical, semi-critical, and non-critical. So critical instruments are the ones that enter the secluded zones of the body. So most of the instruments that we will be dealing with in ophthalmology are critical instruments because they break the corneal barrier and enter the anterior chamber or the posterior segment. So sterilization is not sterilization only. Sterilization has sterilization, storage, and monitoring, and I'll be talking about all of these separately. The most common sterilization techniques that we see are high temperature and pressure, that is autoclave and flash autoclave. Chemical sterilizers, which work in moderate temperatures and moderate pressures, is ETO, and low pressure temperature sterilizers, which is H2O2 and or cold plasma. So we will be covering autoclave and ETO in this talk because plasma is not widely used in our country. So these are the important steps of sterilization, and each step is important, particularly drying and inspection of the instrument. It is not enough to have sterile instruments. You also need to have working instruments and non-damaged instruments. So there are two basic types of sterilizers or autoclaves. One is the gravity-dependent autoclave, which is the vertical autoclaves that you see, in which the steam is let in through the sides and the bottom part, and as it floats up, it pushes the air out. However, gravity-dependent autoclaves have a problem that they do not drive air out of the luminous instruments, that is, instruments with lumen, most notably tubes. High-speed pre-vacuum sterilizer has a pre-vacuum stage in which it drives out all the air, sucks out all the air by creating a vacuum, so that when the steam is let in, it goes inside the luminous instruments easily. And these usually have two settings, either 30 minutes at 121 degrees centigrade or 4 minutes at 132 degrees centigrade. So as such, high-speed, good quality sterilizers do not take more time than a flash autoclave, which we will be talking next. So the next classification of autoclave is according to class N or normal autoclave. Class S is in between N and B, and class B is the one that is supposed to be used in ophthalmology or medical setups. And these have a pre-vacuum and completely removes air from the chamber. So we will be talking mostly with reference to class B autoclaves only. Now we have flash autoclave, which is for sterilization of instruments in between cases, and it works at 132 degrees for 3 minutes at 27 to 30 pounds of pressure. But remember that this is a gravity dependent sterilizer. There is no pre-vacuum. So if you are using this to clean autoclave handpieces and tubings in between surgeries, only the outer surface will be properly sterilized. The lumen may not be taking in steam in adequate pressure and temperature. And also the flash autoclaves are to be used without the instruments being wrapped, so directly on the tray. The packaging consists of cleaning, drying, and inspecting, and then they must be packaged. They can be placed either in rigid containers, and the arrangement of instruments, the hinge instruments have to be opened out. Items with removable parts have to be disassembled. Devices with concave surfaces like bowls, they have to be placed with the concave surface down so that water does not accumulate in it. So if you have a concave scissor, it has to be put with the convex surface up, concave surface down, so that water doesn't accumulate. And of course, heavy items should be positioned away from delicate items so that the latter do not get damaged. Rigid containers are allowed. It's not that rigid containers are not allowed. According to the CDC document, rigid containers like drums are allowed, but this kind of drums, you have to be careful that when you are putting the drum in, you open the air ports, otherwise it will not work. And when you have taken it out, you have to close the lock to close the air ports so that outside air does not enter. We can also use peel open pouches, which may come in separate packages or in rolls, and we can use a sealing machine with that. Packaging material you have already covered by Youngchuman to a large extent, so I will just skip over it for the interest of time. Now, ideally, all instruments should be double wrapped and separately double wrapped. So first you wrap once and then you take another wrap and wrap it twice, not both wrapped twice simultaneously. Loading process must actually allow, the only common sense that has to be applied is that there must be adequate space so that steam can percolate. So this is a wrong way of putting the loading. This is the correct way. So small items should be placed in wire baskets or perforated trays as is shown in the left of your pictures, and peel packs should be placed on edge vertically so that one flat surface is not in contact with the tray. Storage has to be far enough from the floor, ceiling, and outside walls, and it has to allow adequate air circulation and cleaning and compliance with local fire things like it should not be within 1.5 feet of sprinklers. It should not be stored under sinks because any sterile item that becomes wet is considered to be contaminated and should not be used without re-sterilizing. Cabinets for storage can be either closed or open. There is no dictum against either, and any package that has dropped to the floor must be inspected for damage to the packaging and contents if the items are breakable before reuse. Now this is very important slide. According to studies quoted by CDC, there is no evidence to suggest that really a date of expiry exists for packaged sterile items. So if it's stored in covered containers and package is not opened or damaged, there is literature evidence that there is no contamination for up to 2 years. But the dictum that most places follow is that 24 to 48 hours after autoclaving in double wrap we use, and for the others it is somewhere 3 months, somewhere 6 months, somewhere 1 year. For ETO it is 1 year. Now, monitoring of sterilization will be by either mechanical, that is pressure gauges, which I will not cover, or with chemical and biological indicators, which I will cover, which is most important. And the purpose is to evaluate the sterilizing conditions and indirectly evaluate the microbiological status of the processed item. You cannot directly evaluate the microbiological status of a sterilized instrument. So for indicators, there are class 1 to class 6 indicators, of which we commonly use class 1 and class 2 and class 5 and class 6. So what are these? Class 1 indicators are process indicators, which means that the pack has been placed in the sterilizer and you have switched the sterilizer on. So heat has reached the package. So this is a process indicator and it must be used in every pack. Bowie-Dick indicator is a class 2 indicator, which is a vacuum indicator and useful in autoclaves with pre-vacuum, and it only shows that you have properly the pre-vacuum part is working properly, and there is a challenge test in which you have to place it within a set of towels and look at the result. So this must be done about once a month, or if you suspect the autoclave is malfunctioning. The integrating indicator or the chemical indicator is a pass-fail indicator, which checks both temperature and pressure. And biological indicators, so integrating chemical indicators should be used in every run of the autoclave. Biological indicators or BI indicators contain a type of bacillus which is damaged, spores which are damaged by heat and steam, and these have to be tested. Depends either once a week or once a month, or whenever a new autoclave is installed or whenever it is repaired. So for ETO, the indicators are different, and there are different sets of indicators for the H2O2 plasma, etc., which we are not going to discuss. The ETO is commonly a mixture of ETO with CFC or CO2. Nowadays, CO2 is preferred because CFC is ozone depleting gas and is discouraged for environmental reasons. And this is ideal for sharps and reused single-use devices and lumen instruments. Environmental damage, and it is also hazardous to staff, so it has to be used with care. So ETO comes in these cartridges which have to be placed inside the chamber, and the machine has to be turned on. Nowadays, most ETOs are automatic, so they give a record of the temperature and pressure, temperature and humidity and time of the ETO.
Sir, I request you to kindly conclude.
Yeah, I'm concluding. Dry head sterilization is in the form of hot air oven, which is not much in practice because it is time consuming, and H2O2 and plasma also is there, but not very commonly used. So just two more slides on formalin, because some people still use formalin. Formalin is now discontinued. If you are using it, please discontinue, because it is toxic, irritant, mutagenic, carcinogenic, and it is difficult to ensure the concentration of formalin in the chamber, and it is difficult to monitor because indicators are not available. So formaldehyde vapor cabinets or use of formalin in for OT fumigation should be discontinued, because the microbial quality of this procedure is not known, and formaldehyde vapor is very much damaging for the staff. So whatever I have said has basis in this document, which you can find open source at the given link below. Thank you.